covering Leptospira interrogans, the cause of leptospirosis. This scene is going to be centered around a surfer in the tropics, and we're going to call it the Surfer's Oasis. One of the reasons we chose this scene is because leptospirosis is endemic in tropical regions. In fact, in the US, the highest incidence is reported to be in Hawaii. And as far as I'm concerned, only two other things happen in Hawaii: surfing and the filming of Lost. Leptospira is a spirochete, so it's small and thin and spiral-shaped, but it's also sometimes described as question mark shaped. So we'll include both. We'll have this spiral-shaped surfer's leash, and we'll draw a question mark on the surfboard. So Leptospira is commonly found in animals like rodents and dogs, and it's excreted in their urine. And it's usually transmitted to humans when they swim in the contaminated water. And it's commonly associated with water sports, which is the second reason why we drew a surfing scene. So to remember that Leptospira is found in animal urine, and that gets into the water that we swim in, we're going to change up the scene a little bit. Instead of having our surfer riding this nice, clean blue wave, we'll have him riding in on the yellow tide. A yellow tide full of animal urine. Hopefully you won't forget that association. Alright, let's move on to the symptoms of leptospirosis. One of the earliest manifestations are flu-like symptoms with fever and intense headaches. We'll make our surfer dripping wet as if he's been sweating profusely to help you remember that fevers occur in early leptospirosis. Another common finding in early infection is conjunctival suffusion. This is different from regular conjunctivitis, in that even though there's diffuse reddening of the eyes, there is a lack of inflammatory exudate. So in other words, it's just red without the pus. And it's pretty highly suggestive of leptospirosis. So to help you remember the symptom, we're going to give our surfer some rose-colored sunglasses. This, of course, is to remind you of the redness around the eyes. We'll also make our surfer rubbing his eyes as if he just got water in them and it's painful. And this should really hammer it in. So we've already briefly mentioned that the systemic Leptospira infection is referred to as leptospirosis, but in its most severe form, it's also known as Weil's disease, spelled W-E-I-L-S. We're going to change up the disease name a little bit to make it more applicable to our scene. We'll keep the name Weil's disease, but we'll change the spelling to W-H-A-L-E'-S, like the animal. And we'll draw this majestic, breaching, and most importantly, memorable whale, so you can keep the disease name in mind. Leptospira travels through the bloodstream and is able to multiply in various organs. Though it can affect many different organs, we'll go over the two most important, which are renal dysfunction and jaundice from liver damage. So to help you remember that Leptospira travels through the bloodstream and then seeds multiple organs, we're going to draw these inner tubes here that look like red blood cells. And they're kind of getting thrown all over the place by this whale, just like Leptospira is able to go all over the body. Now let's get to the two most important organs it affects. First is the kidney. So if a patient presents with fever and then also has high creatinine levels and azotemia, the first thing you're going to think about is not going to be Leptospira. It's probably just going to be a kidney infection. That's why the history is really important. If it's a somewhat young person who engages in water sports in the tropics, then you can start thinking about Leptospira. But in any case, we're going to have to represent that Leptospira can cause kidney dysfunction. And the way we're going to do this is draw a big rubber dinghy that's shaped like a kidney, and it's being launched into the air by our whale. And yep, those blue and red straps are the renal vein and artery. It's pretty cool. Next, you need to remember that Weil's disease can lead to liver dysfunction and jaundice. So to help you remember this, we're going to change the gray suit of our surfer into a yellow one, as if he's jaundiced. And that should be good enough. And that's it for Leptospira, a really quick one. But it is a bacteria that ruins my second and third favorite things, dogs and tropical vacations. My number one favorite activity is ruined by the next spirochete we're going to cover, Treponema pallidum.